Hey, Nick the Nurse here. We're going to be talking today about Buerger's disease as it relates to nursing school exams and the NCLEX exam. I want to make sure that you know what you need to know in order to ace your nursing school exams and pass the NCLEX on your first try or on your second or third, however many times it takes you. Not going too far off topic, but I do know a lady who took the NCLEX exam 5 times. 5 times, and she is an excellent nurse. She is an excellent nursing instructor. So if you failed the NCLEX more than once, or you failed it once, don't fret. There still is hope. Anybody can pass that exam if they really want to and they study hard enough. Don't let one failure get you down. Don't lose. You can lose a battle, still win the war. Don't give up. Anyway, back to Buerger's disease. Let's talk about nursing interventions as they relate to Buerger's disease. And there's a couple of these that you have to know in order to do well on your exam. Number one, if you'll remember from our signs and symptoms video, I told you that the number one risk factor for a patient developing Buerger's disease is smoking. Smoking those nasty, pungent smelling cigarettes. Now, if you're a smoker, more power to you. Don't develop Buerger's disease, okay? You want to encourage the patient to stop what? Stop smoking. Smoking leads to Buerger's disease. Not in all patients, but many, making it a good risk factor. And therefore, our intervention for combating and preventing Buerger's disease is to educate our patient and encourage them to stop smoking. Get them a nicotine patch, okay? Anyway, assist the patient in preparing the patient for a sympathectomy if indicated. You want to provide analgesics because, again, remember, one of the big signs and symptoms of a patient who has Buerger's disease is intermittent claudication of the arch of the foot. That is painful, okay? So if it's painful, our job as nurses, remember, is to treat pain. Pain, again, is subjective, but we want to make sure that we treat the patient's pain. We want to provide calcium channel blockers to eliminate vasospasms because it's going to be very painful for the patient. We want to monitor those peripheral pulses in the peripheral vasculature of the lower legs and administer vasodilators as ordered to establish and promote blood flow to the peripheral extremities. So remember, make sure that you have the patient stop smoking, that you provide analgesics because they're going to have intermittent claudication of the arch of the foot. Knock that pain out for the patient and provide calcium channel blockers to eliminate the vasospasms and provide vasodilators as ordered after monitoring their peripheral pulses. Again, my name is Nick the Nurse. I appreciate you watching my video and we'll see you next time.